Welcome back. The rate of children diagnosed with autism in the United States has increased exponentially over the past 2 decades. New data released by the CDC this week shows autism affected 1 in 31 8-year-olds in 2022. Compare that to just 1 in 36 2 years earlier. It is 5 times higher than what was recorded in the year 2000 when the health agency first started collecting this data. The CDC believes the increase is due to more awareness and more high-tech screening. However, Secretary Kennedy seems to disagree. In a press conference Thursday, he said, quote, "The autism epidemic is running rampant," close quote. It's destroying the lives of children and families.
These are kids who, many of them were fully functional and regressed because of some environmental exposure into autism when they're 2 years old. And these are kids who will never pay taxes, they'll never hold a job, they'll never play baseball, they'll never write a poem, they'll never go out on a date. Many of them will never use a toilet unassisted. And we have to recognize we are doing this to our children.
Secretary Kennedy recently announced a massive testing and research effort that will involve hundreds of scientists from around the world. He expects that we'll know the cause of the autism epidemic by September. But some scientists are skeptical that there'll be a single answer identified among a multitude of possibilities, including pesticides, air pollution, maternal diabetes, any other things that we put in our bodies. Joining us now, Chief Scientific Officer at the wellness company, Dr. Peter McCullough. Dr. McCullough, what is your perspective on RFK Jr.'s war against autism?
Boy, I tell you, the CDC dropped a bombshell yesterday, April 17th, 2025. First author is Shaw. Over 60 authors on this report, Matt. It's about autism rates at 2022. This is still 3 years old. At 2022, we've now skyrocketed to 3.2% of the child population by age 8 has autism. Some states are much higher. California is at 5.2%, and then even higher yet among boys in California at 8%. And let me tell you, this is not a light diagnosis. 2/3 of these kids needed special education. We know autism can be a devastating diagnosis, some nonverbal, unable to toilet train. And sadly, many actually comprise those who are now transgender people later on in adult life.
Dr. McCullough, we've seen the argument made that there are not higher frequencies of the presentation of autism. It is just that our screening has gotten better and we're better with diagnostics. Do you believe that's true, or do you believe we're actually seeing the rate of autism present more frequently?
You know, the CDC doesn't think that's the case in the report, Matt. They actually have very rigorous screening criteria, and it's not overdiagnosed. And they used multi-level criteria. So this is the real deal. No, it's not just enhanced screening. These are year-on-year changes. The last evaluation was 2020. I can't imagine how bad it is now.
So we saw Secretary Kennedy lay out this strategy to involve all of these scientists from all over the world. What are the data sets that you think need to be reviewed? Is it stuff about pesticides? Is it stuff about vaccines, plastics, environmental conditions? It just seems like there's so many potential causalities, and you want to be able to isolate something for a good control and to adhere to the scientific method.
Well, let's just take combination vaccines right now. So this data set the CDC just reported on, you know, the sample size is 274,000 children. 8,800 have autism, strictly defined. I tell you what, they need to merge that with the vaccine administration record and start looking at, you know, there are a proportion of children who take no vaccines. That number in some places is about 10%. And then you have the other 90% that have taken certain numbers of vaccines in combinations. That's the first thing that should happen from a data perspective.
And with a review of that, you can expect Big Pharma will be very engaged in trying to present their own data. A lot of the evidence that is presented to Congress is funded by Big Pharma. What confidence do you have that Secretary Kennedy can lead a scientific process here that isn't tainted by a lot of the corrupt features that have strangled these very agencies he's now leading?
Well, RFK said in the cabinet meeting he wants an answer by September. of this year. So that means almost certainly no new data. It's going to be a review of existing sources of data. The review panel really has to be free of pharmaceutical influences. We saw that in the Senate confirmation process of RFK and of Jay Bhattacharya, the big pharmaceutical influence that they had over Bill Cassidy and Maggie Hassan and Bernie Sanders. Essentially, they were given their talking points from their big pharma lobbyists.
It is astonishing to me how many lobbyists Big Pharma has for each member of the Senate and each member of Congress. It's not even a 1-to-1 ratio. And a lot of the people who work at the CDC want to go on to careers in pharmaceutical companies. And so they're not incentivized to present data in a way that could upset their future employer. When we learn some of these causalities about autism, do you believe society is prepared to make the changes necessary to reduce the frequency of these terrible ailments?
I think what we should do, Matt, is change the conversation to risk factors, is what we say. You know, in heart disease, I'm a cardiologist, there's no single exclusive cause of heart disease, but we know cholesterol plays a role, diabetes, smoking, family history, hypertension. It's going to be the same here. There are risk factors for autism, older parents, premature delivery, some genetic variants, potentially environmental exposures in food, air, and water, and then, of course, the batteries of vaccines. So we ought to take a multi-risk factor approach, look at them objectively, and then come up with strategies to reduce this incidence. This is going to eat us alive now. This is so big. RFK is right. This qualifies as a chronic disease epidemic.
Well, thank you so much for coming and sharing your perspective, Dr. Peter McCullough, the Chief Science Officer for the Wellness Company. Always a pleasure.